So we recognise that a lot of elderly people struggle with smartphones and tablets and computers, but they're very familiar with the TV. They watch more TV than any other demographic. So our company, in partnership with global TV manufacturer LG, have created a solution that allows family and friends to send messages and call from their mobiles direct to their loved one's TV. That's the Care Messenger solution. And the project from the Innovation Fund is to put 20 of these systems into a care home in Rutherglen, the David Walker Gardens care home, and to address two key things. One is to look at ways in which the system can address social isolation and loneliness, which can be quite common among elderly people, even in a care context in a care home. And also to look at ways in which the system can make communications for the care staff more efficient.
We are sponsoring and hosting a project with Care Messenger within one of our residential care homes. That's David Walker Gardens. For me, the heart of that's about, well, frankly, it's about connections. Social care and indeed healthcare is all about the connections that we enable people to have with one another, the connections our service users or patients have with the staff who provide care to them, and indeed the connections we're able to foster between them and their families and the communities that they're part of. The Care Messenger project then is a way of digitising that within our care homes to enable residents within their own units, within their own rooms, to connect easier with the staff who've got responsibilities to look out for them on a much more responsive basis, but also for them to continue to maintain those connections with their family regardless where they live, whether it be within Scotland, the UK or indeed further afield.
So we have been involved in piloting the Chatta TV project in our residential care home. In the past, what we've found is if we're using tablet devices or mobile phones, the screen's very small, it moves, you have to hold it, whereas on the television screen it's a lot bigger. The person's almost the proper size, real size, sitting in front of you, and that's been really effective for our service users. It's made them feel as if they're in the room with them, which is amazing because they're halfway across the world.
Absolutely. And I think, you know, you could live here and still feel lonely, you know, despite having your neighbours. So we appreciate that, and often all that people want is their own family. So for one lady in particular, being able to see her daughters who live so far afield, Dubai and Australia, for her at times where she's perhaps a bit upset or distressed or missing them, she's able to see them on screen, and oh my goodness, that's brightened her day.
It's quite simple. Yeah, it's basically, they've not given you lots of different options, which is great for us and for the residents. It's a case of, okay, where's your information, and you can look back in your history. So it means that if your family have been on holiday and sent some pictures, then you can go back. If they were having a wee low day or something, then you can go into their history, you can look back and say, oh, who's that? Oh, where are they? And then again, more conversations, and then it lifts their spirits, which is really good.
I find it really helpful for my mum. I think she feels more included because when it comes to the phone, she doesn't focus on a phone. She can't focus on that, so having it on the big telly, so it's more realistic for her.
Yeah, it's absolutely brilliant. Obviously I live in Dubai and my sister Laura, she lives in Australia, and so just trying to connect with mum, I mean, now I literally just press a button and it goes straight to her TV. It's fantastic. It couldn't be easier, and the fact that you can send photos as well is really good.
The partners in this are the South Lanarkshire University Health and Care Partnership, South Lanarkshire Council. David Walker Gardens have been absolutely fantastic, and then we've had the Scottish Digital Health and Care Institute working with Rebecca Thompson on the independent evaluation, and we'd also like to thank the Glasgow City Region for funding the entire project through DISIT with all their ongoing support.